I think some of the strengths of Moorfields Private is that we're able to offer world-class expertise with children's eye services really across the board, not just the consultants that see children, but the allied professionals that we work with, the facilities that we have available to us. I mean, we're one of the few places that have an absolutely dedicated children's eye hospital that sits on its own with an environment that is specifically designed for children. We have people that perform tests if children need tests, that some of them that, almost exclusively work with children day in, day out. And as a whole package, we are unusual in that sense in being able to provide that sort of complete area of expertise, which is really dedicated to getting the best out of children and the best assessment from them and providing the best treatment and service to them. We really have a high level of expertise associated in all the professionals that would see your children at Moorfields Private. Strabismus, in its simplest terms, is a misalignment of the eyes. Now, this misalignment can be where one eye drifts out or when the eye drifts in, or there can be a vertical misalignment, so the height of the eyes is different. Now, normally, when our eyes are working together, they're both pointing in the same direction. When people have a large misalignment of the eyes, that is obvious and it's very visible to other people. But people can also have a small misalignment of the eyes that cannot necessarily be visually obvious, but because of that misalignment, it can mean that the two eyes no longer work together. So people can then experience double vision, which is completely disabling and stops them performing their day-to-day activities, even without having an obvious visible misalignment. There's actually a misperception that strabismus can't be treated in adults. And so I've had a gentleman come to me with strabismus, and he said, I'm here now because my wife's an optometrist and she came to your referral refinement course, and she came home and she said, do you know your squint can be treated? And that initiated a referral. I focus on strabismus in adults and in children and in children's eye conditions, common ones being things such as allergic eye disease, watery eyes, and lumps and bumps that children can get on the lids, such as chalasia. Patients commonly come to me for a second opinion. I would say that probably one of the most frequent things, particularly with children, and a lot of comments I get from parents after they come for a second opinion is, this is the best that I've ever understood the condition, nobody's explained it like that before, or we're really pleased that you were able to explain that in simple terms, or we're really glad we came now, that seems really clear, we weren't quite sure before, or we've had such conflicting opinions, but this seems to have cleared up the matter. So I think that's what, in my experience from the feedback I get, I think that's what people find most beneficial. Is that I'm able to provide not just an area of expertise, but a really clear and concise explanation to them about their condition or their children's condition.
To find out how we can help you and to book an appointment, please call us on 0800 328 3421 or find us online at moorfields-private.co.uk.